I want to welcome everybody here to session 5 of the CARE TA 988 webinar series. I'm Sue Ann O'Brien from RI International. I'm the VP of Crisis System Integration and Technical Assistance. Today, I'm really excited. I hope some of you are repeat joiners of our webinar series because we've had a number of really amazing sessions. Today, I'm really excited that we have 2 different providers presenting about their 988 center. We have Kingsview Central Valley Suicide Prevention Hotline and Suicide Prevention Service and the Family Service Agency of the Central Coast. And I'm joined by Andrea Taleo, who's the Director of Suicide Prevention Service, and David Lopez, the Program Manager at Kingsview.
So my name's David Lopez. I've been with Kingsview Central Valley Suicide Prevention Hotline about 6 years is when I took over. So I've definitely seen a lot of change throughout the years. We've grown tremendously out of team since we started, or since I took over, and we've been operating in the Central Valley since about 10 years now. The focus of today is to talk about what 988 is representing to us. Some of you may heard about it, some of you not, so we're going to give an overview of that, then talk about our center, talk about some of our deliverables, and then just kind of move on from there. So what is 988? So 988 is the new front-facing number for suicide and mental health crises. And this is really different because we're marketing the fact that it doesn't have to be just suicide. It's not the suicide prevention lifeline, it's the suicide and emotional. We're looking at substance use, emotional crisis, anything that can encompass that type of services, the 988 line will service. This started, the 988 number was adopted back in 2020. And this was, as SAMHSA viewed it, the first step to a transformed crisis care system in America. The 988, when it rolled over, it does operate from the existing National Suicide Prevention Lifelines Network, which at the time had about 200 locally operated and funding crisis centers across the country. I believe we're a little closer to about 240 now. I may be off on that. And that unique 988, the 3-digit dialing code, launched last year on July 16, 2022. And boy, were we excited that we could start serving the community in this way. In California, specifically, we have 12 crisis centers. We had 13 and now we're down to 12. And as you can see, they're indicating on the different regions that we have. Mine is the Central Valley, and my primary stakeholder service area is all the way down from Tulare all the way up to Mariposa. So it's my 7 stakeholder counties. So I have Tulare County, Madera, Kings, Fresno, Merced, Stanislaus, and then Mariposa County. That's my primary service area. Because we're in the Central Valley, we have a few dense populations, such as our Fresno, Visalias. Then we have a lot of remote communities. So it's a lot of rural areas, which gives us a unique perspective. Since we are the ag culture of the country, a lot of agriculture, a lot of integrated communities. So it's a really diverse population here in the Central Valley. And so why 988? Well, because our last number, if anyone hasn't heard of it, it was a 1-800-273-TALK. And so when you think of 1-800-273-TALK, I could not recite that number if I was in a crisis. As much as I would love to do it, that'd be a little bit harder to remember. So the initial ideation behind this, or the thoughts behind it, was, hey, let's make something that's easy to remember, that people can use when they're in the crisis, and that we could start to get the promotion behind it. So it serves at a universal access point. So no matter where you live, you can reach a trained crisis counselor who will help you. The biggest thing is that when you call 988, you can call 988, you can text 988, or you can chat with 988. So it's a multitude of fashions. And you will connect to a trained counselor who can help you. And their goal is to help you reduce your psychological, emotional pain, whatever you're going through. It's really geared towards the improvement of immediate service to those in a behavioral health crisis, and reduce the overall healthcare spending with more costly, effective early intervention. Some of the big goals around 988 are to reduce the inappropriate hospitalizations. So people having another ability to help themselves aside from just calling 911 and maybe not receiving the care that they originally need, and to reduce unnecessary justice involvement for people that are experiencing their behavioral health substance use crises, no matter what it be. One of the biggest things is of our vision is to help end stigma and prejudice towards those seeking and accessing a mental health care. One thing I pride myself on, and I really speak to our teams about, and when we're going through our training and all these concepts, is we really want to make this a resource that you would feel confident in having your friends, family, or loved ones reach out to. And I believe everyone that's serving in this capacity across the state is doing that, because we believe wholeheartedly on what crisis intervention can be, and really that if you're lending a helping ear and you're leading with intention and being there to hear someone out, you can do a lot of effective work in helping someone move through that crisis and get to a safer space. What's working? Well, the first year, we really geared towards increasing the capacity across the state to being able to potentially, when we start to ramping up, to meet the anticipated increased call, text, and chat volumes from across the board. We have increased the services that we offered. We did have some follow-up programs that started previously before through Fresno County through an innovation project. And the Lifeline as a whole, we do offer follow-up for individuals who we believe could benefit from that, usually if they're still at a higher degree of risk at the end of the call, but good enough to stay safe for now, we would follow up with them. But now we can offer those services a lot more freely because of some enhanced funding. We did now start offering text and chat services. We're up to 18 hours a day, 7 days a week. And that was relatively new for my service center in the Central Valley. We started, I believe, about 3 months ago doing that. We've increased the training provided to counselors prior to staffing lines. We were about 120 hours of training before they got on the lines. Now we're about 160. So it's about 6 weeks total, 40 hours a week. And then we do some onboarding. They shadow, they listen. They're always supervised with additional trained experienced counselors. We have leads, our supervisor, and our clinical staff that all support the team. What that has done is provided more increased support to the frontline counselors. So having more leads to be able to debrief, to work through some of those more difficult calls, and just having that continuous support has really been an added value that the additional funding and capacity that has been given because of the 988 program. We have increased our outreach. So we have an outreach coordinator that services the whole Central Valley. And not only are we going to tabling events, but we can also host trainings such as Suicide 101. We've done non-suicidal self-interest behavior, both for clinicians and public. I have personally conducted the Columbia Suicide Severity Rating Scales to field clinicians and or different clinics. So there's a lot of different things that people can reach out on, and it really just helps provide that additional staff, that support to the community. We do have an increased amount of quality reviews. So all our calls are recorded for quality assurance. And what happens is our leads and ourselves and our supervisors, we pull those calls randomly and we listen to them, and we try to be as quickly to give real-time feedback to our counselors throughout the process to really help them improve on their counseling skills. And it's not I gotcha, it's like, hey, you did really good here. Here's some added value that we can give you. And then we just try to go on that. All of our calls that end up in an active rescue, which is when we have to actually call out for additional support to keep the individual safe, or a talk down where the individual is at such a high degree of risk that even though they were able to be safe, we listen. Those are mandated that our counselors send those calls to us, and we review them within 24 hours for feedback to our team members and for quality assurance to make sure that we can either follow up with that additional person who may have needed that additional support. So some of our immediate goals, the 988 was, again, the first one was connecting a person in a mental health crisis to a trained counselor who can address their immediate needs and help reduce their pain. Improve immediate service to those in behavioral health crisis with reducing that cost to the community. reducing the inappropriate hospitalization and injustice, help in stigma, and increase the collaboration between 911 and 988. So I like doing little recaps because we're almost all the way there. One thing I didn't mention, we have started a collaboration beautifully with the Fresno Police Department. We just started our 911 988 diversion program. There was a lot of work to get it up and running. I have trained their dispatchers on some dispatch protocols, but it was a very collaborative approach with the police department, with their CIT numbers, the chief of police, and they all bought in. It took us about 6 months to get it going, and we have successfully launched that just about 2 weeks ago, and hopefully to get that that collaboration continuing throughout the valley. So areas of growth. So the awareness of what 988 is and the services provided, that is something I see that a lot of people still don't know what exactly 988 is. I believe that for ourselves and as a state, we can do more social media campaigning, more marketing around it, increased shared resources for the different service areas across the valley. One of the biggest things I want to continue to do, or continue the team to push out, is additional community trainings and to increase that collaboration between the 988 hub and the mobile crisis response team, because the vision overall is to have a more interconnected continuum crisis care services across the state of California, and this could potentially serve as a hub. So we still have some ways to grow there. Now, you're never going to hear me speak anywhere in public without me giving some just brief, quick warning signs, or what I like to also say, invitations when someone may need some help, just to help increase that awareness. Okay, so if you see me ever talk, I'm going to say something about it. So just some quick tips. If you see any market change in their behavior, this could be positive or negative. We just want to check in on that. Reckless behavior, acting in ways that could be dangerous or detrimental, don't seem to care about their consequences. Someone who potentially could be withdrawing, stopping and talking to do things that they do or they like to do. They're feeling isolated or distance themselves from friends and family. And additionally, it could also look like they're anger, like they're pushing people away. So that's just some of the signs that could potentially be there. Some more additional riskier signs are when we're starting in individuals looking for ways to actually take an action against their life. So looking for ways to suicide. This could be something like stockpiling medications, an interest in firearms, or even going to your local hardware store and buying rope and they don't have no reason for it. Saying goodbye and putting their affairs in order, starting to give away possessions. This is something that we see a lot also with youth, because they're a very token gift society. So returning small things to people they care about. Changes in sleep, either they can't sleep or they're sleeping too much. That can also be an indicator. The increase or start of substance use or alcohol use, putting affairs in order, and returning borrowed items for youth, and neglecting doctor's orders. You know, I kind of gleamed over that. You will all have this. Please review it. It's just a lot. There's a lot of good resources out there. You can go to suicideispreventable.org, and there's a great Know the Signs website, and that gives you a little bit more information on how you can actually start having a conversation and the resources. And of course, you can always just call 988. At this point, what we're looking at the future is, again, strengthening and expanding the current Lifeline crisis centers across the board. We are now partnering with Cal OES, or Cal OES has partnered with our centers across the state, and we'll be moving to a new unified platform, which will hopefully improve the data collection across the board, the speed of answering, and this unified platform is going to be a really gift for the state. So a long-term vision is to build out a more crisis response care system across the state and country. So here it is. It's supposed to be the vision, a three-legged stool, somewhere to call, someone to respond, and a safe place to go. Interconnected services and deployment of crisis continuum care are the future for California. We're doing our part to help keep Californians safer, and just please use this as a resource. I turn it over to my counterpart.
Thanks so much, David, for that great presentation. Always appreciate the suicide prevention tips, as well as the recap of And I am going to turn it over to Andrea Taleo with Family Service Agency of the Central Coast. Welcome, Andrea.
My name is Andrea Taleo. I am the Director for Suicide Prevention Services of the Central Coast, and our agency has been around since 1957, primarily providing counseling for our communities for kids, seniors, children, and young adults. We also do senior outreach programs. We have a survivors healing program for survivors of childhood sexual abuse and their allies. We also have a women care program serving women with cancer and their families. And then we have our suicide prevention services. And the three primary things we do with our program is our 988 lines. We also do education, training, and outreach. And then we do have a suicide loss survivors program that we offer for our communities throughout. So we're the Central Coast. So we serve Santa Cruz, Monterey, and San Benito counties. You can see a little arrow there. We serve about 770,000 people across those three counties, in both in rural areas and then within within Santa Cruz, city of Santa Cruz and surrounding counties. We work with different populations, with migrant workers. We also work with people who are more isolated in our communities, and that's some of the work that we're really focusing on in terms of our Spanish speaking presentations and outreach. So as David said, David did a great job in terms of talking about the overall kind of what 988 is about, how it works. But again, I'm just kind of reiterate in terms of, the where 988 fits in terms of the continuum of care within behavioral health services. And so really, when you look at where that lives with all of our partners in the community, it's around really this kind of, it's like a lifeline assessment model, which is what this is right now. So we're really looking at using 988 to connect with our communities. When they call in to our lines, we do assessments around the, in terms of their risk, where they are in terms of their crisis, what they need. If they need immediate response, we do work with our 911 partners, which I'll get to in a minute. But this does really kind of show the flow of the calls. And this is what our responders are trained to do, as are the responders in all of our 988 lines. And particularly in working with the California 988 centers and D.D. Hirsch and kind of pulling together, we've really been able to look at how we're going to standardize some of that training, ensure that there's quality embedded in how our responders are trained. And that's what we're working on now in terms of bringing on new responders to be able to meet the needs of our community. So this is kind of just a basic model in terms of what's happening in the Central Coast right now. So again, a person calls 988. If they are within our local area code, that comes into our lines, Central Coast lines. If we're able to pick up the phone, we do those assessments with those callers. Again, when they call in, they can actually press 1 for veteran, 2 for Spanish, and now there's a LGBTQIA plus line, which is actually the Trevor Project, which they can access, which has been an incredibly important addition to this 988 line. Again, folks call in to us, we do risk assessment. If they need immediate response, currently, this is how our program works. We reach out to our 911 partners, both in Santa Cruz and then also in Monterey. At that point, that's who dispatches any kind of immediate response, whether it be mobile crisis units, law enforcement, fire, whatever kind of immediate response is required for what's happening in that moment. So that's what's happening in our communities right now. We don't, as the Central Coast 988 line, we don't have mobile crisis units within our program, but we really rely on our community partners. And as David was saying, it's really like developing those relationships in terms of how do we do those warm handoffs? What does that language look like? What are the policies? And how making sure that we're all on the same page in terms of sharing resources, but also being able to hand over our callers when and where and when it's necessary. We can, we're able to serve, like, I think 98% of the calls that come in, we're able to work with those callers to de-escalate and end up with a safety plan by the end of that call. So it's only about 2% or 1% of the calls that we receive actually go to our 911 partners. So it's very small percentage. And I think that's very true with most centers across California. And then also with our calls, what we're doing a lot, we're really focusing on being able to connect those callers to local resources, 211, NAMI, Rape Crisis, some of our other partners in the community that are able to provide some of the services that we just don't do. And that's really what this has been, an incredibly important and significant part of being able to provide that glue or a conduit to be able to reach out to our community partners. So I think this is true for all call centers throughout California, or I guess throughout the country. In terms of, you're looking at the incredible increase in the number of calls coming into our lines. And this is just comparing 2021 to 2022. You know, this is a lot, you know, with the onset of 988, just the people remembering that number, calling that number, reaching out to us. So we have spent really the past year and a half, or year, I guess, building our crisis line workforce. And so we went from no staff responders or paid responders last March to 22 staff responders right now. We also supplement that with our volunteer responders to be able to answer those lines as they come in. So you can see that incredible increase in calls. And our goal is to be able to answer our KPIs, key performance indicators that we receive through SAMHSA, through our states, is to have a 90% answer rate for calls coming in and answer, I think, within 15 seconds. I forget what the percentage is. David, do you know what it is?
That is correct. We're supposed to answer the majority of our calls within.
Is it 15 seconds?
Yeah.
So that's really what we've been focusing on here at the Central Coast, is ensuring that we have people on our lines. So again, I'm not sure if people have seen this, but again, this is talking about the long-term vision around behavioral health crisis, the continuum of care, and how 988 is fitting into that overall kind of process. So again, this is long-term, but really right now we are really looking at someone to call. So we are the someone to call. So we focused on that part of the process and that part of the continuum of care. And again, we're working very closely with our county behavioral health. I see I have a couple folks from Santa Cruz County Behavioral Health, James and Danielle they're working very closely with them. We're working with Monterey Behavioral Health, County Behavioral Health, and also San Benito County of Health, just to be able to pull our resources together, see what's out there, and being able to, for 988 to be able to reach out to mobile crisis directly, working with them to, kind of free up our law enforcement to be able to focus on, emergencies that require a law enforcement response. Again, this is the long-term vision. So again, this is where we are as a community. So along that continuum of care. So again, 988 is providing a linchpin or a stepping off point for us to be able to really partner with our, again, behavioral health, 911, 211, NAMI, some of our other county facilities, our other behavioral health providers, and being able to really build on those relationships so that our responders know what's out there, who's out there, and who we can actually refer folks to, or who we need to call when there's immediate need. We're doing a lot of data sharing. We're doing a lot of planning together. Again, agreeing on what do warm handoffs look like? What are the policies? What are the processes? Who do we call? Do we have the right phone number? Do we have the right contact information? So it's really ensuring that we have the structure set in terms of being able to have the bones of and design of this from us to build from. So as part of what we're doing in terms of prevention, it's really around education and prevention work that we do. So with Suicide Prevention Services, we do evidence-based trainings in our community. We do assist, we do safe talks, and we've developed our own kind of hour presentation called Let's Talk About It, which we're able to do in Spanish. And so it's really reaching out to our Spanish-speaking communities you know, providing our trainings in a language and culturally appropriate way, so that we are building that trust, as David talked about. You know, so if people feel comfortable calling our lines, they feel comfortable and they're confident in the work that we're doing on our lines, and also in terms of being able to do those warm handoffs to other folks. We're doing a lot of work around, you know, kind of getting the word out about 988. So we have flyers, we have posters, which were provided through Vibrant. We're doing print ads, we have press releases, we have flyers, we have our social media. We're building on that, because getting the word about 988 is really it's all of our responsibility. And as David was saying too, it's a number that people can remember. So the more people know about it, the more calls we get, and also being able to go out into the community and doing some very basic suicide awareness prevention trainings around know the signs, know what to say, and then what are the resources that you can provide to that person who is in crisis or is calling for someone in crisis. So we've done a lot of work around that. And then also partnering with our 211 and 988 partners. You know, when do you call 211? When do you call 988? And when do you call 911? I mean, it's people like, I don't know what to call when. So we've done a lot of work around, again, community education, and then really, again, connecting folks and all of our partners together so that we're sharing these resources. So what are we working on? Again, it's really working with our other 988 call centers and really kind of solidifying and building those coalitions, sharing information, sharing data. How are we building our workforces? What's working, what's not working? What are our best practices? Again, we're really involved with our county behavioral health partners in terms of what our mobile crisis response teams look like. We're going to be offering text and chat starting in July. We're just building that right now. We're training our responders. We're learning the systems. Text and chat is a little bit of a different beast than calls are. So how is it different? How do we respond? Again, making sure we have enough folks on our line. And then we're also looking at exploring and training and working with students in the field. We have a lot of local colleges here and universities, and how do we build them into our overall program? We do have a counseling side of the house, which they're very interested in bringing on interns as well. So it's just reaching out to our different partners in terms of our colleges and universities. Again, continuing our 988 trainings and working with a unified platform, which is going to be rolling out in California, which will connect all of the call centers with a really robust new platform. And then again, working on referrals and follow-up for our callers. And those follow-up calls are really important in terms of just ensuring that people who were in crisis, or people that we have done safety plans with, that they've actually following their safety plans and they're getting the supports that they need. So that's what we've been focusing on.
Both of you touched on this a little bit, but I wanted to highlight some of the key stakeholders. I know a lot of you mentioned the interface with 911, 211 versus 988, and also other community partners, law enforcement, NAMI, some of those key stakeholders. I wonder if you could say a little bit more about those partnerships and how important they've been in terms of the delivery of your 988 services and ongoing care. And we'll start with you, David.
Over the years, I've been able to develop a really great relationships while working with the counties and the Department of Behavioral Health across our stakeholder region. And because of that, they've always been, or throughout, they've been supportive of what we were attempting to do. And if you have, or those strong relationships really go a long way when you're implementing or requesting to do something different, or even they ask. So it's really important for us. I'm thankful for the relationships and support we've had. And it goes everywhere from the departments of behavioral health to other different, nonprofit community providers, the hospitals that are in our areas. Luckily for me, I used to work at the crisis stabilization unit here for about 5 years, so I had a great relationship. And Kingsview actually has the mobile crisis response teams for Fresno. So another great relationship. And so my old clinical supervisor is now the director. It's hilarious. So it all kind of plays in, right? So I'm just thankful for the people who have continued to support the vision of what we've had. And it really takes the community to get something this big going and making it a successful program.
A great example is our work with 211 in terms of they maintain that resource guide for all of the different communities in terms of if you're having housing insecurities, if you need food, if you need to reach out for different services. So, we are serving people who are suicidal and people who are in crisis. We don't spend, once we've assessed that they're safe and we've kind of understanding what they're looking for, we want to be able to give them the resources they need so we can go ahead and answer phone calls from other folks, right? So having access to those resources allows our responders immediate access that we can give to that caller so we can make sure that caller is given what they needed. So we rely on 211's, resource pages for our responders. And then with 911 and then with our behavioral health partners, really looking at doing some joint grants. How do we work together? How do we share fiscally? How do we access dollars and funding together in a way that makes sense for our communities? And so just really being able to open up those conversations and those discussions has been incredibly impactful for our communities.
Yeah, and those relationships and partnerships have just been key, like you both kind of mentioned the three-legged stool, building these components. And in a lot of places, there's pieces and parts, but we're trying to fill in the gaps. And you guys have been instrumental in doing that by bringing people together and making those linkages with the other stakeholders in the community. We touched a little bit on the key performance indicators. I wonder if you both might say a few words about how you manage the overall performance of your agency. What do you look for? What are you measuring on a regular basis? And what strategies have you used to deploy kind of a continuous quality improvement strategy?
Well, I measure the success of the program measured upon the amount of people and the quality of service that we give to the actual person in crisis. That's ultimately the true measure of success. So someone that comes in who's not in a good space, potentially willing to take their life at wit's end. And if we can give them that unconditional positive regard, support, and just through that listening ear and helping them tease out between, hey, I may want to take my life today, or maybe just at least stay safe for now. That's a success. However, like some of our deliverables, I can speak to that in a second. There is power in the anonymity of calling in, right? Because it is anonymous, people are able to oftentimes speak to things and situations that they may not even speak to if they're in therapy with their therapist. That is one of the most common things I hear about. So there's a big cathartic release that can happen with those individuals just from able to be expressing themselves without fear of judgment, not having to be in front of that person, because that is difficult for people to communicate. So that being said, we do attempt to collect the basic demographics, the ages of our callers, their race, everything that you would go into that spectrum, but we try to do it in a manner that is really conversational instead of like I'm just doing up a checklist, right? So we want, if we can get it, find out if they're married, yes or no, if it's part of the conversation, yes or no, like, oh, it sounds like you were in a relationship. So that's the way we weave it into data gathering, as opposed to just give me all this information before I serve you, especially if someone's calling in a crisis. The last thing you want to do is fill out a form to speaking someone. That's not the way 911 works, and that's not the way we work. We're here to help immediately with that individual. Some of those key performance indicators that has been set before us are answer rates. So definitely improving the answer rates across the state. California equates for, I believe, and Andrea, you can help me out, it's like 40% of the calls of the nation or something close to it.
Yeah, something close.
Yeah, so we do have a high call volume here, and we are expected to answer over 90% in-state answer rate. So really working at getting to 95 to 100%, especially with the additional capacity that we brought up, and to reduce the speed to answer. That's a big thing that we're really working on collectively. Each one of our call centers is doing their due diligence to achieve those goals. And we know that the last thing you want is when someone's calling is to be waiting and waiting and waiting for service. So those are the ultimately is improving the skill set of the counselors, answering those calls in a relatively, rapid manner, and then getting those answer rates up. That's the measure of success that I view. Andrea, please feel free to add anything I may have missed.
In addition to our KPIs, which are the answer rates, and then also in terms of time to answer, we look internally in terms of safety planning for our callers. 98% of the people who call into our lines have been assessed as at risk. We start with the 2 questions. Have you thought of suicide today or in the past few days? Or have you taken any action to kill yourself today? So if they answer yes to one of those questions, we consider them at risk. And we go through the assessment. We do some follow, the assessment we do in terms of rating them where they are in terms of the 1 to 5 or 5 to 1. And then we also make sure that we're doing safety plans and safety agreements with our callers. So we're ending the call saying, do you agree to stay safe for the next 24 hours, and call us if you don't. We really spend a lot of time ensuring that our callers, when we end the call with them, that they have that safety plan or safety agreement with us. We also look at the kind of the mental health of our responders too. So we've been doing a lot of kind of surveying our responders, like, how are you feeling? Are you feeling supported? Are you getting what you need? Are you feeling overloaded? What can we do to help? So we've really been focusing internally on the mental health of our responders and and all of our staff, really.
That's great. And with a 98%, I think you said 98% resolution rate over the phone, that's one of the highest I've heard of, probably nationally.
We end the call with, do you agree to stay safe in the next 24 hours? And so those are for folks who have been assessed at risk. And the way that we look at those numbers, we have call reports for all of our callers. And then so we track that for when calls come in. So that's an important thing for us.
Yeah. And your follow-up occurs on, do you have a structure to that?
We do. So we ask if they would like to receive a follow-up call, and then we have to do those we have to do those follow-up calls within 24 hours, and then we try twice. And if they don't respond, then we don't do anything after that. But then with our follow-up calls, did you get the support you need? Did you get the resources that you need? How are you doing today? And so we that's kind of a next kind of goal for us, is to really focus on those follow-up calls, because they're incredibly important to the ongoing, kind of mental health of the folks that we're serving.
Both of you talked about, I heard innovations, really amazing things both of you are doing that are really unique to your centers that I haven't heard about anywhere else in the country. So kudos to both of you for the fantastic work that you're doing. So because we already heard a lot about some of your innovations, I wonder if you would each just share what you're most proud of.
Well, I would say I'm most proud of being able to lead this team and take this team collectively through the pandemic, because that was a big challenge. We served through that, and I learned a lot more about myself and leading styles and how you have to be along with the team. And I'm very grateful that they were able to stay with us, and we all got through it together. And as Andrea was saying, like, that health and safety of my counselors was something I was very concerned about, because now we used to have a central hub call center and we deployed into our homes, right? So now they were taking that crisis into their homes. So that really shifted the way, the amount of check-ins, the way we did check-ins, the way of debriefings, really had to elevate to meet the need of the team. Leading more with a servant type of leadership, really helping them be supportive, making them take time off from the lines. It's like you had to program some things in to really keep the team healthy. I'm very thankful for them. They do the hard work. I could just do the training. Even we can answer the lines, that they do the lines, right? And we're just here to support them. So That was my biggest win. I'm glad that my team has grown. I kept almost everyone, or they go in to be crisis co-responders like I was. I speak all this path right to them. So just to help elevate them throughout their career as well, it feels really good. As this program has grown, it used to be very small, and now I have a team of about 50. And so there's another layers of support that we've been able to build in. And because we've grown, my team has grown with me. And so I really believe in promoting from within and creating that levels of success for them, so they can have like an actual career ladder with either within our department or to move on to other areas of our organization.
I think that in terms of successes, I don't know where this belongs in that, but just being part of this incredibly watershed moment for behavioral health services and really just having these really very earnest and authentic conversations with different community members and partners and individuals and families around mental health. And kind of the whole stigma around suicide, and be able to use that in a language that people are not just necessarily like just freaking back from, but being able to have those conversations more and more and more. I think that as a community for the Central Coast, just being able to just get out there and just share the messaging, and this has provided a platform to do that. And then the funding that's coming down to be able to staff these lines, I mean, that's been incredible. We went from about years ago with all of our volunteers, I think we were at like a 40% answer rate a couple of years ago, and now we're at I think we're at 89% answer rate, even with the increase in calls. And if we didn't get that commitment all the way from the White House down to the states, down to our counties, that wouldn't have happened. So this has just been an incredible time to be part of this, behavioral health services, and just kind of opening up that discussion within our community. So I think that's a success.
This is our last one here. Your biggest challenge, or what lies ahead that you are tackling next?
We have a lot of goals, and I would just say continuing to work towards those goals. That's going to be a challenge no matter what, because as we have ramped up the capacity and now we're able to meet with current call volumes, with the increased marketing push that will start to roll out, it is how do we maintain those rates? How do we maintain the health of our teams? So as we have elevated our skill sets, now with the increased call volumes that are likely to start to come with a more marketing push, how do we ensure that we can actually continue to deliver that level of service at those rates that are desired? So I would say that will be one. And the second being just increasing the awareness. There's communities that historically, even though it's a great 911, 988 is a great number. However, it can signal something different to different communities. And I really want to help demystify what that is, because it is a healthy number and we are here to help.
Being able to serve youth, in terms of our crisis lines, as David was saying, is sometimes we aren't able to collect the demos just because we don't ask. It's an anonymous line, it's confidential, but just being able to use this as a platform to be able to, again, how do we develop a program around peers, serving peers, for our younger callers, and how do we encourage them to call our lines? There's some of these crisis centers that have wonderful peer programs. Love to start something like that here, because our kids are having a hard time, right? So how can we better serve them? And then the other challenge, again, is around, and this is not just for our center, but it's for our community. It's just like, how are we going to be able to build out these systems, particularly around mobile crisis units, stabilization centers? It's just, it's just the beginning, so, but how do we collaborate? What's the best way to do that? And that's a challenge. It's also, it's a great opportunity. So it's both.
Yeah, there's a lot of work ahead. You guys are definitely part of the group that's leading some of that change in California. And I love what you both shared today.